Okay, next thing is the one more cause of the vomiting center. Okay, we discussed till now. First is the cytotoxic agent is the first cause. Second is the motion sickness is the second cause. How the vomiting reflex is triggering via using the pathway, I already discussed with the in the previous video, so please go through that. And next, the third cause is the emotional factors, pain, repulsive smell or repulsive sight. Okay, so as your normal human being, so what is happening, if you have any smell or else by seeing the sight of any blood, immediately we feel that vomiting. Okay, that is stimulated in the higher center of the brain. Okay, higher center of the brain. Okay, so by all these factors, immediately the stimulation takes place in the higher center of the brain. The higher center of the brain which sends the signals immediately to the vomiting center, and through the vomiting centers it's been entered to the vomiting reflex, that is via direct pathway. Okay, this was not including any further pathways, directly higher center of the brain to the vomiting center and vomiting center to the vomiting reflex. Okay, so this is the fourth cause. Okay, my dear student, this is the first cause, and as it is the second cause, this is the third cause. Okay, next we see the fourth cause. Okay, other causes of the vomiting reflex, that is here if you see that this is a medulla oblongata, and where it is the brainstem, which is downwards propulsive to the esophagus and connected to the stomach. Okay, so in the stomach we have a different kind of the pits. Okay, that pits are called as enterochromatin cells. If you see the zoom in nature, here it is the stomach, we have a enterochromatin cells. Okay, that is nothing but enterochromatin cells which release the serotonin. Okay, this serotonin which releasing from the enterochromatin cells in response to the cytotoxic agents. Cytotoxic agents are nothing but chemotherapeutic agents are the one which is administering to the drugs. So by that time what is happening, immediately the enterochromatin cells in the stomach which is release the serotonin. Okay, so once this serotonin was released, they stimulate the 5-HT receptors in the sensory nerve fibers, usually in the vagus nerve, that was stimulated, and immediately that send the signals to the vomiting centers and vomiting reflex takes place for the patient. Okay, you see my dear student, this is the medulla oblongata, pons medulla oblongata brainstem, which is connecting to the esophagus mouth and esophagus to the stomach. In the stomach we have a different kind of the pits of glands. Suppose if you take the zoom nature, we have a enterochromatin cells. These enterochromatin cells which releasing the serotonin in response to the cytotoxic agents. Cytotoxic agents are the chemotherapeutic. Once I told you already, chemotherapeutic agent which compulsory inducing the vomiting. Okay, so once the serotonin is releasing, stimulate the 5-HT receptors, the sensory nerve fibers, through the sensory nerve fibers, and usually the vagus nerve was stimulate and producing the vomiting, sending the signals to the vomiting centers, and where there is a production of the vomiting reflex. Okay, so this is the fourth cause of the vomiting. Okay, fourth cause of the vomiting reflex. And next if you see, so I already discussed with you four causes. First cause is the cytotoxic drugs, second is the motion sickness or morning sickness, third is the emotional factors and pain and repulsive smell and repulsive sight, and fourth is the cytotoxic drugs which act on the enterochromatic cells, how this vomiting is takes place. Okay, so apart from all these things, if you comes to the conclusion, okay, these are all the factors which are eventually triggering the vomiting center. Okay, that is the final thing. But since the vomiting center is triggered, so how the vomiting reflex comes in the sense, so vomiting center which is stimulating the vomiting reflex, so once the vomiting reflex takes place, there is an, please try to assume this is the physiology my dear student, once the vomiting reflex, okay, stimulates, the contraction of the diaphragm, okay, contraction of the diaphragm takes place, and one way, in another way it lowers the esophageal sphincter release. Okay, it lowers the esophageal sphincter release. Okay, these are all the factors which eventually trigger in the vomiting center. Vomiting center stimulating the vomiting reflex. Okay, once the vomiting reflex stimulates, there is a first thing is the it lowers the esophageal center release, and one more thing is the contraction of the diaphragm muscles. Okay, once the contraction takes place in the diaphragm, there is an increased intra abdominal muscle contraction, increase intra abdominal muscle contraction. Once the increase intra abdominal muscle contraction, the food and fluid which push back into the mouth and immediately inducing the vomiting. Okay, so by the time the same way, by the time of the vomiting reflex, epiglottis is closed. Why? Because once the epiglottis close, we can prevent the food to be enter into the lungs. Okay, so that only epiglottis being closed, and via increased contraction of the intra-abdominal muscles, the food and fluid which push back into the mouth, and through the mouth the vomiting is inducing for the patient. Okay, so this is the complete physiology of the vomiting reflexes. Okay, now we'll see the drugs, okay, where it is been acting. So I told already classification of the drugs. So what we have to do, we have to first we need to use the antagonist. Okay, so if you use the antagonist, they don't receive the impulses, or else they don't receive the signals, they thereby they stop the vomiting. Okay, so if you see that here